Heart failure is a condition where heart doesn't beat well, leading to various symptoms: shortness of breath, swelling of feet or ankle, inability to sleep comfortably, fatigue, passing out spells, and sometimes sudden death. Heart failure usually is seen in patients who have either lack of blood supply to the heart muscle, or they have heart valve disorders, or if their heart muscle for some reason is just weak and not able to pump blood to meet the body's oxygen requirements. So heart failure is a complex disorder. It involves a team approach, and we do have such a team here at Jackson Hospital. We set up a heart failure clinic last December, and we have seen close to 50 patients in that clinic. The clinic comprises of a physician and a pharmacy team that help making sure that patients are on appropriate medications and they are taking those medications. It involves spending a lot of time with them, going over their symptoms, their dietary habits, and their compliance with their medications. So the focus of the heart failure clinic is to make sure that the patients remain out of heart failure and do not require repeated hospitalization for their heart failure symptoms. There is now a way of remotely monitoring their symptoms and preempting hospitalization by sensors which are implanted inside the pulmonary artery. One of these sensors is called CardioMEMS. We will be starting implanting this type of sensor at Jackson Hospital in the very near future.
I'm Terry Harris. I'm the clinical pharmacist on the cardiology floor for Jackson Hospital.
And I'm Kelly Slayton. I'm a pharmacy resident at Jackson, and we're both a part of the team-based approach in the heart failure clinic at Jackson.
Well, we support Dr. Arshad's efforts for maintaining the patient with heart failure. Heart failure has to be a management of the medicines, diet, and exercise, and as much support as we can give to the patients will help them self-manage and self-care for themselves. It's not just what we can do, it's what the patients can do for themselves.
Pharmacy will usually go in first before Dr. Arshad comes in. We just kind of get a general overview of how the patient's doing and if they have any issues with their medications, and if there's anything we can do to help. If it's a problem getting it or forwarding it, we look into that. And then we go and talk to Dr. Arshad and tell him everything we kind of gathered while talking to the patient.
Well, it's wonderful what we've been able to achieve in some instances. We had a patient that came in great distress, and 6 months later, how she was so much more able to walk, to exercise, to be active, how she was just so far out of that really bad acute stage, and it really touches your heart to see somebody doing so much better.